Hi friends, somatic educator and medical massage practitioner Jennifer Drancic here. I'm also the owner of Fusion Whole Body Recovery. I wanted to have a little video today to go over several variations of the somatic movement arch and flatten. As you may know, 80% of us in the world suffer from back pain sometime in our life, and these movements, though they're easy and yet focused, are very, very powerful. So you want to do this in a nice quiet room. You also want to do it very slow, because what do we have to do when we go very slow with movements? We have to focus. And what focusing does through the entire movement is it changes our subcortical pattern. So basically what we're going to be doing during these movements is teaching our back how to let go of habitual tension. I always like to compare it to throwing a baseball. Your back has been throwing a curveball for, who knows, 10 to 20 years from sitting at computers or standing for long periods of time, or from some kind of trauma. So what we're doing through these movements is actually teaching it a new pitch, teaching it how to let go of that tension on a more permanent basis. And these movements are also great because, let's say you work at a computer 8 hours a day and you won't be able to stop doing that. These movements you may have to do more at the beginning of your practice, or you will have to do more because we're changing that subcortical pattern. But as the weeks pass and you're feeling really wonderful, you go ahead and go back to these movements, and it's like riding a bike. Your body's going to know really quickly that it's done these movements before, what we're trying to accomplish with the movements, and it's going to let go of tension 10 times quicker than it did in the past, because we've developed that subcortical new habit. So you want to do this in a nice quiet room. You want to go very slow. So go ahead and lay on your back, and we're going to start with just the first movement is just the simple arch and flatten. So your arms are going to be towards your side, your knees and your feet are going to be hip width apart. And all it is it's going to be a arching of the back and then a pelvic tilt, but we're going to go very slow. So we're going to inhale in as we arch. That's kind of the general rule of somatics, is you inhale in on the work, exhale in on the release. So go ahead and inhale in, rolling the pelvis, pressing the tailbone down into the ground. And then when you feel discomfort, notice the discomfort. That's your body talking to you. Say, I feel you, and I'm going to focus on you. So as you release with an exhale, you're going to really focus on that area of discomfort that you felt. So that is your body saying, hey, you need to release me first. And notice how I melt into the ground. You don't see my back flop into the ground. And then we're going to inhale in neutral. And then exhale. And as I exhale, I'm going to simultaneously start to tuck. Again, when we do things simultaneously, just like going slow, we have to very much focus. So I'm going to do that pelvic tilt. I'm going to imagine bringing my pubic bone up towards my chest, kind of creating a C with my body, and then I'm going to slowly release that. Okay, now with this round, what I'm going to do is I'm going to, it's nice to explore my body. I want you to really notice what your shoulders and your head do with these movements, because when you release the back, you release more than just the back. You're releasing your shoulders, your neck. You're relieving tension throughout the spine. So go ahead and inhale in, arch the back. Notice how the shoulders just gently want to press back into the ground, because we're engaging the posterior extensors of the back. So all those muscles in the back. And then slowly, gently ease off that. Inhale in and neutral. Exhale and start that tuck. And as you tuck, simultaneously exhaling, just notice those shoulders kind of want to round forward as you're tucking the pelvis. The head becomes slightly lighter on the ground, so you can feel the correlation between if I have an over-exaggerated curve or I'm tucked too much, how it's going to influence the neck and the shoulders as well. So a lot of our clients come in, they, are very surprised when we start to work on the back and the hips before we get into the shoulders and the neck, if they're coming for shoulder and neck pain. And that is just a good example of fixing the problem and not the symptoms. Okay, so you're going to do that about 10 times at home. Then we're going to go ahead and go into the arch and curl. So when you do an arch and flatten, you're not fully engaging the front of your body and not fully opening up the back. So, because that's what we're doing. When we're moving the hips back and forth, we're reteaching the spine how to move open and closed. So what we're going to do is we're going to add a little curl to it to help open up the upper thoracic area a little bit more, as well as helping the low back. And it's going to help us engage and release the diaphragm area here, which is also going to help with breathing and internal rotation of the shoulders and things. So go ahead and take a deep inhale in, arching the back, arch, 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 pressing down. You're going to notice the elbows kind of want to go back because those shoulders are pressing back, and then slowly exhale and release. Now, if the hands aren't comfortable here because you may have some shoulder impingement, just bring them out here, mimic the movement, and that's fine. So we're going to inhale in neutral, and then as we exhale, this time we're going to tuck, 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 just like we did before. And then when we've tucked as much as we think we can, then we're going to bring those elbows in just slightly, and we're going to use that area right under our hand here to lift up our upper body. So you shouldn't be straining through the neck. If you notice you don't hear a change in my voice, if I was using my neck a lot, you would hear more of a strain like that. So make sure you're only coming up about an inch or two to engage the abdominal muscles and open up the thoracic area. And then simultaneously, we're going to inhale in, and we're going to let go of that pelvic tilt and that curl. Awesome. So you're going to do that a couple times, maybe 5 to 10 times, depending on what you feel. Remember, always focusing on areas of discomfort that you feel in your body as you're doing the movement. You want to think about engaging and releasing that area as you move through the movements. Okay, so we've done the arch and curl, we've done the arch and flatten. Now we want to start working on individual side bodies, because we don't work just, bilaterally all at the same time. We want to really teach our bodies how to work independently side to side. In these next couple movements, you're also going to notice some dysfunction that you may have not noticed prior. And to us, noticing things like that is very powerful, because if we didn't have that information, then we wouldn't know that we need to make the changes that we need to make in order to get better. So it's great to find out where you're dysfunctional for that reason. So first we're going to do a same side arch and curl. So the movement is going to be the same, but we're going to take our hand placement and do something a little bit different. So I'm going to go ahead and take my right hand, keep my left hand behind my head, grab my left knee. So we're working on the left side first, opening and closing that. And we're going to do the same movement. So deep inhale in, arching the back. You're going to notice as you arch your back, your knee is going to press naturally into the hand. That's fine. This is going to be harder too, because you're restricting movement. And then slowly exhale, let that arch go. So we're closing and arching that left side. And then inhale in neutral. Exhale out, and as you exhale, you're going to tuck, tuck, tuck. And you're going to notice that knee's going to naturally want to draw towards the chest. And when you're tucked as much as you can, bring that shoulder towards the knee, which is going to bring the elbow towards the knee, and we're going to open up that whole side of our left spine in the back. And then simultaneously inhale again, like we did with the arch and curl and the arch and flatten, and just let it go. See, I'm going to let it melt as simultaneous as possible. Okay, and you're going to do that about 5 to 10 times, releasing that side, and then go to the other side and do it as well. So the other side, we would take the left hand, grab the right knee, right hand behind the head, and then the same thing. So what we're doing is we're opening up each side individually so we can do side-to-side movements, and it's going to help open up the discs in the low back, because sciatica, things like sciatica and arthritis are caused by continual pressure on one side where the disc may shift and then create a bulge or herniation to the opposite side. This is going to help open up the disc space and allow the disc to move back over towards where it needs to be in the neutral space, so it's not impinging nerves. So it's a great movement for sciatica. And then lastly, we're going to do the arch, diagonal arch and curl. So again, we don't move forward and backward only. We don't move side to side only. We also rotate. So this area, I want you to imagine there's like a ball of string right at the base of the spine, and we're actually going to be working it diagonally to help with rotation and help with mobility in the low back. So same move, but actually I'm going to grab my right knee, and then I'm going to bring my left hand behind my head. So now same side knee, same side hand. So same move is we're going to do an arch with an inhale. Feel that knee press into the hand. I'm pressing my tailbone into the ground. And then slowly release that as we exhale. Inhale in and exhale out and start to tuck, 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 tuck. And then once we're tucked as much as we can, we're going to bring that shoulder to the opposite knee, opening up the space between the shoulder blade and the hip. So you're going to do that a couple times, maybe 5 to 10 times each side. So one thing I really like to do to focus on opening up this area is whenever I do the diagonal arch and curl, and you can do this on the same side arch and curl too, but it's just going to be the same shoulder blade and hip. But when I do the arch, what I like to think about is I'm bringing that shoulder blade down, that left shoulder blade down towards the opposite hip, so towards the right hip. So those two are coming together when I arch because I'm bringing them both back into the floor. And then I'm going to release that. You're going to go slower at home. And then when I do my curl, I'm opening up that space between the shoulder blade and the hip. So again, you can see that these arch and flatten moves aren't just good for the back, they're also good for shoulder pain and neck pain as well. So I hope you guys enjoyed the video. If you guys have any questions, please comment below and have a great day.